Mhm. It's Paige Keaton. I'm back. I am here I'm at my house now. I'm not at my parents' house today. So I'm actually the studio. Got that little mic podcast. And I'd like to read it out loud. Is the concern. Okay, let me just I've decided early in between this that I was gonna do an introduction each time without being too fancy. You can go to at pagepotpie.com and basically right now it's a blog that I'm using to write about an experience I had last in 2009 there for almost a full month of them trying to figure out how to save her life because she was almost died in their care, and they wrote off almost everything all in her bills because they can't it's obvious. And so I filed a complaint and with their supposed to be anonymous, like medical, not associated with the hospital at all. But the envelope, the certified mail envelope, it comes straight from none other than them. And so this independent investigation that was non-biased on the first page comes from none other than that treated my mother. So paragraph 2 of page 6. And my concern, according to my complaint, is multiple questions relating to use of Narcan. And your mother was a hard wake, which is what the anesthesiologist told me. Another hyphen. Narcan was administered inappropriately by the anesthesiologist and not documented. Yeah. Hyphen. Narcan, in parentheses, caused the Takotsubo, which is misspelled. It's Takotsubo syndrome experienced by your mother. Okay. Findings of my concerns are partially substantiated. And it says, upon arrival to PACU, there was an episode where your mother's oxygen saturation dropped due to breathing difficulty. Staff took immediate action to maintain her airway and assure proper oxygenation. Anesthesia was in the clinical area, wherever that means. And a certified nurse anesthesia provider responded to her bedside. Like, there is no such thing. There is a certified nurse anesthetist. So I'm not sure if this person is that partially reversed the effect of her anesthetic. This action corrected the temporary concern, and her recovery proceeded normally without further incident. The Narcan administered was a normal dose. Literature suggests that for partial reversal of anesthesia in elderly patients, use of a smaller sequential dose may be considered. The decision regarding the dose used falls within the provider's discretion. A treating provider must determine the safest and most effective course of action based upon their training, experience, and patient condition. Course of action based upon their training, experience, and patient condition. Inappropriate use was not substantiated. Narcan can be a life-saving drug for patients that have depressed respiratory effects from certain anesthesia-related medications. Yes, I've researched all that. And it's been used, gosh, the latest doctor's journals I find are like 1978. I've got it bookmarked, and I'm going to write a blog. I need to know that since 1978, when they started doing studies on this, they did find that the people getting Narcan were having this Takotsubo syndrome, cardiomyopathy. They didn't have that name for it then. But they sent them home so quick that it's not really studied. because it is used for outpatient, you understand? And you can have an episode of Takotsubo syndrome and not know it. You just come home from surgery, your heart might have blown up. You don't know what your ejection fraction is. You don't know, because what it is like you blow up a balloon, and then it gets a weak spot. It has a weak spot, and it's usually in the bottom left ventricle, and that weak spot like blows out like a soft like, and it causes the squeeze of the bottom of your heart to not squeeze correctly. It's slow, and so you can't get enough out each pump. It slows your heart, and then this up here is like, well, right? We have 4 chambers, remember? So confusing. But when you look it up, you can read about it and look at diagrams and all this stuff, and it's there. So I'll link you to it, and you then can read it. Okay? Where am I at? Takotsubo again. Takotsubo identified in 1990, and thus is a relatively new clinical presentation. It is considered as a rare condition. TCM is most commonly associated with acute physical or emotional stress, such as major surgery. That's funny that's in parentheses. In parentheses, it says such as major surgery. So you just give it to everybody that has major surgery then? That doesn't make sense. This is fun, and I'm glad I went. I'm glad I went to the post office to pick this thing up. Almost missed it. Okay. Sorry. And Takotsubo comes from the octopus catching device that they use in Japan that looks like it has like a little pot belly thing that comes out of it. And that's what, when the doctors kept looking at the hearts of the people that were having this from being emotionally, oh my God, and their heart, oh, and it filled with adrenaline real quick, kind of like Narcan does when you pump it. You know, we all saw Pulp Fiction. They don't do it straight in the heart. They do it straight in the IV. It does the same thing. Okay, here we go. Parentheses. Okay, it says, I'm going to read that sentence again. It is considered as a rare condition. TCM, which is Takotsubo syndrome, is most commonly associated with acute physical or emotional, such as major surgery, remember, and earned the unfortunate name broken heart syndrome. This syndrome is more common in elderly women. 90% of cases are women with a mean of 70 years. As you observe, TCM, as I observed, that's funny. No, funny. TCM can unpredictably occur after acute withdrawal of chronic opioid use. Yes. As you observed. Me, as I observed. Broken heart syndrome can happen right there in front of you and can unpredictably occur after acute withdrawal from chronic opioid use. Now, the anesthesiologist hand wrote, she signed off on the bottom of it, my mother's sign-in paperwork, and she hand wrote the words chronic pain before she ever administered. I don't know who it is. I'm assuming it's a woman. This is the one I talked to. Right there with that pink, right where the pink is, you see. Oh, let's focus. Let's get it, because I'm gonna. It's already on. This is already on my website. Y'all can all go look at it. And there it is, with the pink and the highlight. Chronic pain. This happened before. 3 hours before she was given the Narcan, which can cause an acute amount of stress, sending anyone that's a chronic opioid user into withdrawals, making them, well, have terrible side effects like extreme pain because you just sent them into this weird withdrawal, like a baby being born. That's like that's kind of what happened to her. And they're saying, and I've got the little chart right here, and you can follow it and see that no, she wasn't getting better. Because even me, I can see it from here. This line starts going up, and at this line is where y'all had given Narcan, and then right here it starts going up, and y'all decided to get the Sugammadex. And then there was morphine and fentanyl and Vicodin, all in between these minutes that you told me on the first page that you were sorry that you didn't let me know that I was supposed to be told that it was taking longer, but y'all were under control with her. And this is all I have besides a few things y'all shotgun through these. I haven't even tried more paperwork, which I have every right in to go and get any. I'd love to see the video of the cardio cath that Dr. LeShen did on her to show how extreme her cardiomyopathy was. Like he said, because nobody told anybody about it because y'all didn't put it in the system. And I'm like, I don't know how many, that's, am I done with this paragraph of page, 2 pages? See? Oh my gosh. Let's see. Oh yeah, it's because she's old. And she was old. And that was the deal in the hospital. And that's what the deal was. It was put off on her age. She must have had blockages. There was something pre-existing condition with her heart that was going to justify why she was going through what she was going through. But nothing did, because when Dr. LeShen went into her heart, he agreed that there was no blockages that required any stents or any other type of surgery, that she was pretty much fine. All of her organs, she's cancer free. What she is elderly, overweight. There you go. So they thought that she was, and she had suffered this. I mean, they laid her out. Her heart was no longer pumping at its regular thing. And if you look at all the notes, I think, I haven't even gotten there. We haven't gotten to the flash PE yet, or the other one that I think she had an ICU that wasn't reported when they were coming to her all night long before the cath, telling her, it's okay. It's okay. You just got a broke heart, Miss Keaton. It's okay. Like, while you're pulling a gallon of fluid off of her at 2 a.m. How are told about that the next morning? Yeah. Anyway, what time is it? Because I gotta go. Nope, I still got time. That TCM's cause is more likely due to factors with a single mechanism, not enough to explain its occurrence. Given these facts, while it's theoretically possible that Narcan administration might have played some role in your mother's development of TCM, there is no way to them in any way. She was a money maker, is what she was, because she was in and out. How many times can you blow up a balloon with Narcan before it gets a weak spot? We are taught, because I was there, and I'm not making this up. You weren't there, and I'm reading this like you think that I couldn't piece this together. And I hope you watch it. I don't care if you do. Maybe someone else will learn. I'm going to look into how to figure out how to take the medication. How many people don't? And you send them home, and they just die of an old heart attack. But 90%, maybe 95% people don't. Nor do they know that you're giving them Narcan at the end of their procedure, when you could, by all accounts, and it's documented, and I have it bookmarked, and I will link it, just do a little more oxygen therapy and let them wake up naturally. Huh? Boy, that's an idea that might save a lot of people's heart from experiencing a sudden rush of adrenaline that according to the cardiologist was like taking a bat to the thigh. Now, that's quite an explanation. And I'm curious to talk to any doctor that approves that even if it's 5%, and you just keep renaming the Narcan something else, but it's got the same ingredient that causes this sudden rush of adrenaline to the heart that wakes us up enough to have a loved one shove us in a car. And that was what was about to happen with my mother and I. We were about to be in a car going home. If they hadn't delayed her MRSA results, we would have been gone. He tried at 7 a.m. to get us out of there. Not only that, y'all sent her to the room, given her that. You came there she was fully drugged up, completely out of it. Pictures on the website, pagepie.com. And you can see it's still in place. She talked to me specifically about it, saying she's going to be fine. But she wasn't, because you'd already given her the drug that reversed it. So I am curious that how we've missed something. We've missed something on paragraph 2. It's interesting. And it gets more fun as we go. The benefit of preserving your mother's breathing greatly outweighed the risk for development of a rare medical condition, such as Takotsubo, you mean? It's only, I really do think Takotsubo is only rare because it's in the surgical field and people send them home so fast that if they have it, you can survive it. It goes back. Like, you can survive it without medicine. You just are weak. And so you can come home from a surgery. This is if you're a chronic pain patient and you go in there and you think, well, I'm about to get some good drugs. But now they're blasting you with Narcan at the end of it, and you don't even know that's happening. So it's a reversal of opiates, and it's sending your body into withdrawal symptoms. And there are a lot of people, old people too, my mother, covered in osteoarthritis. They try to talk about I see the scars on her body. She must have liked painkillers. Well, geez, dude, like, really? Is that what you're trying to put this on? That your anesthesiologist didn't pay attention? That, hey, she probably needed more liters per minute to get through that wake? Or talk to a family, come out and see where she's at. She's been tired. She was tired. She needed straight oxygen therapy. You weren't getting her up. She had her shoulder reversed. Totally. Ugh. Y'all. So we went over one concern. How many minutes? 20 minutes. That's perfect. I'm wanting like 20-minute long videos. So I'm going to end. I'm going to come back. I've got the next page. It's a small one. We're going to do this. Oh, that's a dumb one too. Y'all are dumb. I can't believe that y'all chose to. Oh, and what we didn't talk. Before I hang up, my concerns. Narcan was administered inappropriately by the anesthesiologist and not documented. Well, it talks about this weird CN anesthesia provider responded to her bedside. It says it is documented that a single dose of Narcan was administered by his order, and it was in his nurse's notes, but it didn't go into the EMAR system, it's not even showing coming from the pharmacy. You know why? Because you'll order this hours before her surgery. The Narcan was ordered at, I found it, it's like 1 or even 11, like, I think it's at 1. She didn't get out of surgery until 2. So you knew you were going to blast her with it. I want to see how many times she was with her hands. You even lift a suture in her hands. that they found during this shit, and they had to go get pulled out. Y'all have sutures in her. Like, I have pictures of that. I have pictures of the bed wounds y'all gave her because I didn't move her for 7 days. This is real lives. This is the family. These are people that love their mother and love their father, and they see things that happened here that as a group we can agree that this is not okay, not for anyone, not ever, and things should change. So I'm out. I'm going to leave and I'll be back. I've got to go to work. I've got to go to work.